I do believe strongly that attitudes can change, and I think I'm a living example of indeed how attitudes can change. And I do believe that it comes when you discuss your own stories first and you listen to other people's. When I became the Minister of Labour in January of 2010, there's a variety of things you can choose to do in Minister of Labour. I wanted to focus on occupational health and safety, but specifically on my second day I knew that I wanted to focus on mental health in the workplace. And of course, the reason being I gave was, well, it's about productivity, it's about the cost to the business, it's about growth and innovation and all those things that are important to the employers and of course important to the employees. And my true motivation was that I did have fear of stigma. And in 2004, when I had my second son, I ended up suffering from postpartum depression. Very lucky to have a good general practitioner who recognized the signs of it. Otherwise, I think I would have probably worked through it through the entire time without either cognitive therapy or pharmaceutical intervention, which was needed in both cases in my case. But I didn't tell. I didn't tell because for number one, I did feel that I was still productive at work, and I did feel that I was still giving at work. I didn't realize, though, that I probably wasn't giving everything I could have should I had had treatment. But I didn't tell because I was very concerned about being sent home, not being able to go to work, and all those things that are associated with stigma. So now when I speak in my portfolio and I tell my story, the reason is that I truly want the workplace, federal jurisdiction in our case, to be a place where you don't have that fear, because this could happen again, and I personally don't want to have to deal with the concerns of whether or not to report, because I know that when you speak up and you seek treatment, you're going to be better.